Hello, everyone. My name is Darlene Zangara, and I'm the Executive Director of the Minnesota Commission of the Deaf, Deafblind, and Hard of Hearing. I'll start with a visual description of myself. I'm a white woman with blonde hair, glasses, and am wearing a black shirt. I'll update you about some of the things my team and I have been working on these recent months. "2025 State of the State Address with Captions and ASL. The Commission would like to recognize the crew of TPT Twin Cities PBS Engineering, Technology, and Marketing teams and interpreters Nick Zapko and Patty McCutcheon from Keystone Interpreting Solutions for their work at making the 2025 State of the State Address accessible for Minnesota's deaf, deafblind, and hard of hearing audience. The Legislative Coordinating Commission and the Governor's Office were essential partners in this collaboration. The Governor's speech was streamed live with ASL and captions on TPT's Almanac at the Capitol on April 23rd, 2025. If you missed the live event, you can catch the recording on TPT. The Collaborative Plan for 2025 to 2030. The Collaborative Plan is a network of agencies, schools, and organizations that work together to create positive systemic changes to achieve better education and career outcomes for students who are deaf, deafblind, and hard of hearing. In 2018, the Commission researched the needs and gaps in serving deaf, deafblind, and hard of hearing children ages 0 to 22 and their families. This resulted in a list of identified strategic issues and action steps to work on from 2019 to 2024. A lot has changed since then, especially with the COVID-19 pandemic. It is now time to follow up on the 5-year plan and find out if these issues are still essential and if there are any new action steps that we need to pursue. Last fall, the Commission hired Wilder Research Center to develop a new 5-year collaborative plan for 2025 through 2030. We completed a statewide survey during the Collaborative Experience Conference in November. In January, we hosted interviews and focus group meetings with approximately 60 professionals and parents. Then on May 8th, the Commission is hosting a statewide summit with over 50 professionals and parents. Together, we will finalize the priorities. The summary of the report will be completed in July of 2025. CEASD Conference. Danelle attended the Conference of Educational Administrators of Schools and Programs for the Deaf, CEASD, in Pittsburgh, Pennsylvania, from April 9th through the 12th. CEASD advocates for individuals on the national level by working with government agencies to influence educational policy and implement federal legislation. This year's conference featured a range of topics focused on building connections that transform deaf education, exploring the meaning of least restrictive environment for deaf, blind, and hard of hearing, examining how the current political climate impacts special education, among others. Looking ahead, the Minnesota State Academy for the Deaf, MSAD, will have the honor of hosting the 2026 CEASD Conference at the Mall of America from April 22nd through the 24th, 2026. We look forward to welcoming more Minnesota educators to this important event. Donnell and the Commission team continue to monitor the political climate with the Federal Education Department. As of this filming, there have been no changes to Minnesota's Early Hearing Detection Intervention and Minnesota's Department of Education DHH program. We will keep you informed of any upcoming changes within Minnesota's educational system for the deaf, blind, and hard of hearing students. Legislative Task Force on Aging recommendations. Last year, the Commission provided a presentation with recommendations to the Legislative Task Force on Aging. In January 2025, the task force submitted a final report to the legislature with recommendations on how to support an aging population in Minnesota. We are pleased to share that our recommendations were shared in the report. The recommendations include: have state agencies partner with the Commission and with the deaf, blind, and hard of hearing state services, also known as state services, to update statewide older adult resources. Update statewide data collection efforts on seniors to include questions on hearing loss and accommodations needed. Raise awareness on State Services Minnesota Access to Communication Technology, MNACT program, i.e. hearing access technology. Screen all adults ages 55 and older for hearing loss. Allow ASL fluent hospice workers and volunteers to work at multiple facilities statewide. Collaboration between the Commission and the Minnesota Department of Health about health equity. Continued collaboration between the Commission and the Board of Aging. Study hearing aid services reimbursement rates. Work to get Medicare coverage to include hearing aids. Develop an ASL fluent caregiver workforce. Create policies that support housing communities for deaf, blind, and hard of hearing residents. We have a lot of work to do, but we are happy these recommendations have been recognized and are included in this report. Once implemented, these will make a difference for aging Minnesotans who are deaf, blind, and hard of hearing and their loved ones. The report is available online at the Legislative Reference Library. Accessible prescription labels. The Commission's Government Relations Director, Alicia Lane, worked with legislators and pharmacy representatives to agree upon requirements for providing accessible prescription labels. Those requirements for Braille, large print, and audible labels are now in the process of being implemented. For Braille and large print labels, the Minnesota Department of Health has updated its list of pharmacies offering Braille and large print labels. For audible labels, MDH did an assessment and has published their final report. Key takeaways from that report include: among outpatient pharmacies that responded to MDH's survey, approximately 40% currently provide audible labels. Most of the pharmacies that offer this service are larger chains or healthcare systems. The main reported barrier for pharmacies to provide audible labels is the financial commitment. MDH recommends that policymakers balance the need for audible labels with pharmacies' ability and financial feasibility to provide them. You can learn more about accessible prescription labels online. Minnesota's deaf, deafblind, and hard of hearing history. Ann Sittner Anderson is gathering stories, photos, and videos about the Commission, community advocacy, and deaf, deafblind, and hard of hearing history during the Commission's 40 years of existence. We have gathered a lot of great stories over the years, and they are available on the Commission's history section on the website. But we know there are stories missing. If you know anyone who should be interviewed, or if you would like to be interviewed, please let Ann know. Here are some pictures of recent events. In closing, did you know that the Commission staff frequently provide workshops and presentations to state agencies, community organizations, and nonprofits? We are available to present on topics such as legislation, how to meet your legislator, voting 101, accessibility, and other deaf, deafblind, and hard of hearing issues. If you would like for us to present on a topic, let me know. My door is always open. Please contact me anytime you would like to discuss deaf, deafblind, and hard of hearing issues in Minnesota. Thank you.